Hello, my name is Phil Burke, and I am a physician assistant at Variety Care, and I'm currently the director of HIV and viral hepatitis services. I'm going to talk to you today about what is HIV, who is at risk for HIV, as well as who should get tested for HIV. So let's start with what is HIV. HIV is an acronym that stands for Human Immunodeficiency Virus. HIV is a special virus called a retrovirus that attacks the immune system, specifically a cell called the CD4 cell, or a T cell. So that cell, the CD4 or T cell, is very important in helping your body fight off infection. So what's a normal level? So a normal CD4 count is between 500 and 1,000, between anyone who's not HIV infected. That's just a normal level. If the CD4 count or the T cell gets below 200 cells, or a patient acquires one or more opportunistic infections, like pneumocystis pneumonia or Kaposi sarcoma, at any CD4 count, then HIV infection is considered to have advanced to AIDS. So what's AIDS? AIDS is actually an acronym for Acquired Immunodeficiency Syndrome. This is that period of time when you're less than 200 CD4 cells and it's easier for you to get sick. So what's a life expectancy? Normal life expectancy without treatment is between 0 and 10 years, which depends, of course, on the CD4 count at the time of the diagnosis, as well as whether someone is considered to be HIV positive or have AIDS. Overall, life expectancy of an HIV positive patient that is on ART or medication and linked to care is the same as HIV negative patients, although HIV positive patients are more likely to have more comorbidities, other things that make it easier for them to get sick. So is there a cure? Currently, there is no effective cure. Once people get HIV, they have it for life. But luckily, with proper medical care, HIV can be controlled. People with HIV who get effective HIV treatment, or ART, can live long, healthy lives and also protect their partners from becoming infected. All right, so let's move on to who is at risk. So these are groups of people that are at higher risk for HIV infection, or just at risk in general. So any person having unprotected anal or vaginal sex is at risk. Men who have sex with men are at risk, and we know that gay and bisexual men have had the largest number of new HIV diagnoses in the U.S. So although they're one of the main targets we see, they're not the only target or group at risk. Other groups at risk include transgender women who have sex with men, IV drug users, any person having sex with someone who's using IV drugs, any person having sex with someone who's HIV positive, as well as commercial sex workers. In addition, we do know that Blacks and African Americans, as well as Hispanics and Latinos, are disproportionately affected by HIV compared to other racial and ethnic groups. So obviously those are groups that would be at risk as well. So now let's move on to who should get tested for HIV. So currently, the CDC guidelines on HIV testing include once-in-a-lifetime testing for everyone aged 13 to 64. For those people at higher risk, the CDC recommends testing yearly. When we talk about higher risk, it goes up to the risk groups we talked about earlier above. So sexually active gay and bisexual men may benefit from more frequent testing every 3 to 6 months, but the recommendation is still once in a lifetime or annually if at higher risk. Variety Care currently offers HIV testing, prevention, as well as treatment. If you have any questions about HIV, you can visit our website at www.varietycare.org/UYOU or www.cdc.gov/HIV. Next up will be Guiding Right, who will be giving a presentation or discussion on HIV testing.
Hi, my name is Jennifer Lee. I'm a nurse practitioner with New Hope Wellness Center, the clinical arm of Guiding Right Incorporated. I'm going to talk to you today about the different types of HIV tests. The first test I will go over is the HIV-1 and HIV-2 antibody test. This is a one-time use rapid test which detects antibodies to human immunodeficiency virus type 1 and type 2 using a drop of human fingerstick blood. These tests are used on-site and can give you results within 10 minutes. If you are unable to make it to our office, we provide in-home tests which you can use from the comfort of your own home. This type of test can detect HIV if the exposure was 24 to 30 days before testing. Depending on the timing of exposure, it may be necessary to have multiple tests over time or a more sensitive test. The antigen and antibody test looks for both HIV antibodies and antigens. Antibodies are produced by your immune system when you're exposed to viruses like HIV. Antigens are foreign substances that cause your immune system to activate. If you have HIV, an antigen called P24 is produced even before antibodies develop. This test can detect HIV if the exposure was 18 days before testing. As mentioned earlier, it may be necessary to have multiple tests over time or a more sensitive test depending on the time of exposure. The NAT test, which stands for nucleic acid test, is a test that looks for the actual virus in the blood and involves drawing blood from a vein. The test can either tell if a person has HIV or tell how much virus is present in the blood, also known as the HIV viral load test. The NAT test is the most sensitive and can detect HIV if the exposure was as recent as 7 days prior to testing. Now you will hear from my colleague, the President and CEO of Guiding Right, Theo Noel.
Hi, my name is Theodore Noel. I'm the President and CEO of Guiding Right Incorporated. As mentioned earlier, in-home HIV test kits are also available. Although you take these tests from the comfort of your own home, we are available to walk you through every step of the process. Here's how our in-home test kit works. First, we mail you the in-home HIV test kit. Next, we'll call you to make sure you actually receive the test kit. When you take the test, our caring team of healthcare providers are available to walk you through the steps over the phone. We will then go over your test results. We can even send out a case manager to confirm the test results and go over the next steps. You are our primary concern. We want to make sure that you feel safe, comfortable, and confident with your test results. If you test positive, we will then connect you with a qualified medical care provider to get you started on your treatment options within 48 hours of diagnosis. If your results are negative, we can still connect you with a healthcare provider to talk about the best options available in preventative care. Please keep in mind that testing services are confidential, with one exception. Positive results are reported to the Oklahoma State Department of Health, since HIV is a reportable disease as set forth by state guidelines. Then and only then will information be shared with the respected entity. The health department will track positive results by contacting you in person or by phone. Coming up next is Teen Clinic at Variety Care on consent for testing and treatment services.
Hello, my name is Isosa. I am an adolescent health specialist for Teen Clinic at Variety Care. Today, I am going to be talking to you about consent for testing and treatment services. If you are in Oklahoma and under the age of 18, you are considered a minor. No worries, you can self-consent to get tested for STIs, including HIV. This means that you can receive a test without parent or guardian permission. If your test is positive, it means an infection or virus was found in your body. Your healthcare provider will talk to you about treatment. If you need treatment, you can access it yourself without a parent or guardian's permission. You can also access PrEP and PEP without a parent or guardian's permission. Your healthcare provider will help you through the process and answer all your questions. The earlier treatment for HIV begins, the better. That's why regular testing is so important. To empower yourself or another youth in your life with medically accurate, comprehensive sexual health information, please visit us at varietycare.org/teenclinic. To connect with us on social media, follow us on Instagram and Twitter at Teen Clinic OK, and on Facebook at Teen Clinic by Variety Care. Next up is Rusty Rooms from Diversity Family Health on preventing the spread of HIV.
My name is Russell Rooms, and I'm the nurse practitioner for Diversity Family Health, and I want to talk to you about prevention of HIV. There are basically 3 ways that we can prevent you from getting HIV. Number 1 is more about treatment, and we'll talk about that more in the treatment section, but if somebody has HIV and they're on their medication, most likely we can get them to what's called undetectable, which means those people cannot transmit the virus if they were to engage with another individual. So that's one way to prevent HIV, is being on treatment. The second way is through post-exposure prophylaxis, or what we know as PEP. And that is, if you've been in contact with HIV within the past 72 hours, we can give you a medication that will keep you from getting HIV since your body came in contact with it. It's normally 28 days of medication that you will take to make sure, again, that you don't get HIV if you've been exposed. The third way is pre-exposure prophylaxis, or what's known as PrEP. And that is one pill that you take once a day that will prevent you from getting HIV should your body come in contact with it. It's 99 to 100% effective against HIV as long as you're taking that one pill once a day. And that's the only thing, however, it protects you from. Not gonorrhea, chlamydia, syphilis, any other sexually transmitted diseases. So that's why it's still important for you to wear some type of protective barrier like a condom when engaging sexually. While you're on PrEP, we'll want to see you every 3 months for several reasons. Number one is to make sure you're not that 1% that gets HIV while on PrEP. Number two, to check your kidney function to make sure that we're not doing anything bad to your body in the process, because there have been cases, about 3% or so in the studies, of people having some kidney injury while they're on PrEP. The third reason that we would want to see every 3 months is to address any of those other sexually transmitted infections that you may have gotten during the time that you were on PrEP. There are actually 2 drugs that we would use for PrEP, or pre-exposure prophylaxis, one of which is Truvada and the other which is Descovy, and it would be up to your healthcare provider to determine which one is best for you. I hope this has been informative and you've learned a little bit about ways that you can prevent getting HIV. Again, my name is Russell Rooms, and you can find me at Diversity Family Health at www.diversityfamilyhealth.com, where we can address all of your sexual health needs along with some of the other partners that you've met during this presentation. Coming up next, you'll be talking to my good friend Phil Burke with Variety Care, who's going to talk to you more about what to do if you do have HIV and the best thing to do for treatment.
Hello, my name is Phil Burke, and I am a physician assistant at Variety Care, and I'm currently the director of HIV and viral hepatitis services. I'm going to talk to you today about what happens if you test positive for HIV, as well as a little bit about treatment for HIV. So let's start with what if I'm positive. If you test positive, the first thing that is important to know is that HIV is no longer a death sentence, as long as you get in and stay in care with an HIV medical provider. There is currently no effective cure. Once people get HIV, they have it for life. But with proper medical care, HIV can be controlled. People with HIV who get effective HIV treatment can live long, healthy lives and protect their partners. Contact your PCP or an HIV provider as soon as possible after learning about a positive HIV status or diagnosis, so that an appointment can be made for you. Additional lab work may be needed to confirm HIV diagnosis if the original HIV positive notification was found through a rapid test or from OBI after donating blood. Once HIV is confirmed, if needed, additional blood work will be needed as part of your initial HIV workup, which may be completed by your primary care provider or an infectious disease specialist. So is there treatment? There is effective treatment for HIV and AIDS. Anyone who is HIV positive should be placed on medications for HIV called antiretroviral therapy, or ART, as soon as possible. First thing we'll talk about as far as treatment is something called rapid start. So it is very important for anyone to start on ART as soon as possible after being diagnosed to reduce overall inflammation in the body. Rapid start is normally when we start someone on ART or HIV medication within 7 days. But definitely within 30 days, and hopefully get them linked into care. So next I'm going to talk a little bit about treatment as prevention. So treatment as prevention, we know that the longer someone is HIV infected and not on treatment, that it's easier for them to spread the virus to others, whether unknowingly. So the idea is if we get someone on medication quickly and get their HIV viral load controlled and non-detected, then they cannot pass it on to anyone else. So there are multiple single tablet regimens available for HIV treatment. So 1 pill a day, which has changed from previously when sometimes patients had to take multiple pills 2 or 3 times a day with multiple side effects. Overall, the medicines are much cleaner than they used to be, which is easier for the patients to tolerate. Depending on whether your HIV infection has any resistance mutations, single tablet regimens may not be available, and this should be discussed with your HIV medical provider. ART medications, or HIV medications, need to be taken daily, ideally around the same time of the day, to make them the most effective. The goal is always not to miss any doses, so establishing a daily routine around medication administration is very important. Missed doses can lead to development of resistance mutations, which, if they occur, can cause modification of your ART regimen and possibly make it impossible for you to be on a single tablet regimen. In addition, some other medications, including over-the-counter products and vitamins, can interfere with some of your ART medications, so make sure to discuss with a medical provider before starting any new over-the-counter or prescription medications to avoid potential drug-drug interactions. And lastly, once in care with a medical provider and on ART, it is important to maintain regular care and follow-up with your provider for your overall health, as well as to avoid potentially running out of HIV medications. Once you're in care, stay in care. Variety Care currently offers HIV testing, prevention, as well as treatment. If you have any questions about HIV, you can visit our website at www.varietycare.org/UYOU or www.cdc.gov/HIV. Next up is Dr. Kate Arnold, the Director of Women's Health at Variety Care. She will be giving some final closing thoughts.
Hi, I'm Kate Arnold. I'm the Director of Women's Health at Variety Care. Thank you for trusting us to discuss HIV with you. We know that this can be scary. We also know that as a patient, it's tricky figuring out what you need and what clinic to go to. Everyone in this video cares about you. That's why we've done this. We all believe that the most important thing is you, our patients, feeling comfortable to seek out care. And we don't care if you come to our clinic or someone else's, just as long as you come to a clinic. Please reach out to any of us. We've heard it all and are comfortable taking care of people of any race, any gender, any sexual orientation, insured, underinsured, or uninsured. Even if you're not ready to stop high-risk behaviors such as IV drug use or unprotected sex, we can help you avoid HIV. You have the power to stop the spread of HIV in Oklahoma. Please take the next step in protecting yourself and your loved ones by calling one of us to make an appointment.
Thank you from ISOSA. Come see me at Teen Clinic at Variety Care.
Thank you. I'm Russell Rooms, and come see me at Diversity Family Health.
Thank you. I'm Jennifer Lee from Guiding Right's New Hope Wellness Center. Come see us.
Thank you from Theodore Noel, President and CEO of Guiding Right. We'll look forward to caring for you.
Thank you. I'm Phil Burke with the Infectious Diseases Clinic at Variety Care Reno. If you need our attention, we are always available for you.